Hey guys, and welcome back. Today I'm going to be talking about a little bit of a taboo subject, and that is money. More specifically, how do general practitioners make money and how much money you can make as a GP. Now, of course, I understand that I'm coming from a place of privilege and that I do live a very comfortable life, and this is not me trying to rub it in how much I make or anything like that. Until I started working in GP, I had no idea how GPs were paid. So this is more to be informative than anything, and I apologise if anything I say can be misconstrued as arrogant or rubbing it in. Honestly, not my intention. But with that disclaimer aside, let's talk about how do doctors make money, and more specifically, how do general practitioners make money? So when you first graduate from medical school here in Australia, you go into the workforce, usually into the public system, although there are some private interns as well, an intern. During this internship, you are earning a salary. That is to say, there is a set amount of money that you will earn in that 12 months, regardless if you work in medicine, surgery, ED, though mind you, all of those are requirements to get through your internship. What I'm trying to say is, it doesn't matter where you work, you earn the same amount of money that year. There are a couple of reasons why you might earn more, but you will never earn less. Some of the reasons you might earn more include working after-hours shifts, some weekends, public holidays, and if you're doing overtime. All of these are essentially penalties that you are paid for. It does vary state to state though, so I am talking more about my experience in the Queensland system, so I apologise if I get anything wrong about your state. But that's the general gist. Interns are paid a salary. So that's all fine and good, but how much money is that? So I have my phone here to talk about the numbers. So currently on the Queensland Health website, it states that interns are salaried at $77,000 a year. So that's a really good baseline wage for someone who's just come out of university. Now, this is for 80 hours a fortnight, so if you're part-time versus full-time, it will vary, as you would expect. Side note, yes, it's 80 hours a fortnight, but that's rarely what you actually work as an intern. It's usually a lot higher, but the whole unpaid overtime and things like that is a completely different discussion and not something I'm going to get into today. So after your internship, you become a resident or a junior house officer, at least in Queensland. If you want to know about all the different levels, I do have a video about that, but that aside, according to Queensland Health, depending on where you work, you earn about $83,000 a year. So there's a little bit of a jump, which is great. Following this year, there are several different streams you can go down. You become a registrar, an unaccredited registrar, PHO, an SHO, and all of them are considered different levels. So the salary is really hard to track from here. When you're still in the public system, you earn a salary, just like you did in an internship in your junior house officer years. Again, it'll vary depending on the hours you work, the penalties that you do, so overtime, after hours, on call, that sort of thing. So it's really hard to give you a number from here. Now, there are several benefits to having a salary, especially in the public system. Some of them include paid study leave or professional development leave, paid leave, so 4 weeks a year, paid maternity and paternity leave, accrued sick leave, which is paid, so you get paid if you're sick but not at work, and accrued long service leave. Of course, all of those benefits do come with negatives, being on call, long hospital hours, hospital bureaucracy, government bureaucracy, so it's not all rainbows and sunshine, but there are some benefits. So what about those outside of the public system? Those of us in general practice work in a very different way. Think of us like fee-for-service. Now, we do have the ability to charge whatever we want for our services, but it's a bit more complicated than that. You have to think about the competitive nature of private practice, the affordability of your services, the time it took you to become a GP, all of that sort of thing. Now, in Australia, we have something called Medicare, which is different to the Medicare in the US. To put it really, really simplistically, the government will cover a certain percentage of a charge that GPs put out, giving you a rebate at the end of the day. This is to try and keep healthcare affordable. So bulk billing is when the GP only charges you what the government will pay you. Put it simply again, say the government will give you $37 back when you see a general practitioner. To bulk bill, the GP then will only charge you that $37. So that means essentially you got a free service. You pay $37, but you immediately get $37 back. That's what bulk billing is. It is a fantastic way to make healthcare really accessible. That being said, the rebate is not always sustainable for most people to live off. You wouldn't ask your plumber or your electrician to take your money and then give it back to you immediately. There's no government incentive for plumbers and electricians and whatnot. GPs aren't too different in a way, because we're paid fee for service, just like they are. We are specially trained, just like they are. You pay a plumber or electrician based on their experience, the fact that they have the tools, the fact that they know where to get things and when to refer on to other plumbers and electricians. Sorry, my analogy's just gone out the window. You know what I'm trying to say though, right? You're paying for a service. So let's look at what's generally charged in GP. We haven't even got to how much we earn yet, because it's really complicated. So every service that a GP does is tied to something called an item number. Some of them are time-based. So a consult under 5 minutes gets one number and therefore one rebate from the government and one charge. 5 to 20 minutes is another. Over 20 minutes to 40 minutes is another. Over 40 minutes is the other. So there are 4 item numbers for time-based. But then there are certain circumstances or consultations that will have another item number. Mental health care plans, GP health care plans, mental health care plan reviews, antenatal care, doing a pregnancy test, inserting an implant. All of these have different item numbers and therefore different rebates attached to them. So why don't we bulk bill everything? Well, that's complicated. So I'm going to read off a script here because I find it really difficult to verbalize what I'm trying to say eloquently without reading. So, for example, take a simple consult that takes between 5 and 20 minutes that doesn't fit any other criteria. That's called an item 23, or a standard consult, or a level B consult. Medicare rebates $37.60 for this service, and the average charge is about $85 across the board, which means you're $45 out of pocket for up to 20 minutes with your GP. This is probably the most common item number billed. Why? Well, to be able to do all of that takes a lot of time and money. We do lots of extra training to be able to provide those services. Remember, your GP is as much as a specialist as your cardiologist or your endocrinologist or your general surgeon. We just have a wider scope of practice and not as much depth as someone like an endocrinologist who only deals with endocrinology. In a private practice, GPs will see about 3 to 4 patients per hour. So if you extrapolate that, I've done the math, you work 8 hours a day, see 3 people an hour, 24 patients a day, we charge $85, it's about $2,000 a day. That sounds great, but there's a lot behind the scenes that you probably don't know about. We don't take all that money home. Depending on your contract, you may only take 50% of that back. And the rest goes to the clinic to pay for the room, the electricity, the water, other wages, your equipment. So if we charge a full $85 for an item 23, then you'll be earning a lot more than someone who bulk bills. $47 more, thereabouts. I guess you could think about it like a commission. It's really hard to explain. The thing is, we don't choose what numbers we charge. That's set by the government. And there's rules around it and we're audited a lot. Also, you can't combine item numbers. It's really complicated. It's also important to remember that GPs don't get sick leave. If we don't work, we don't get paid. We don't get holiday pay. If we don't work, we don't get paid. We don't get study leave. We don't get maternity leave. We don't get long service leave. If you don't work, you don't get paid. A lot of us don't work a 5-day week. Like I said, I work 4 days a week, but still 40 hours a week. But I'm only seeing patients for 34 of those hours. So that's 6 unpaid hours that I'm at work, physically doing work. Because I'm not seeing patients, I'm doing. This is why GPs don't let you just call up for a question or sign something, outside of your consult time. You wouldn't ask a gardener to repot something when they're not working on your garden. You wouldn't ask an electrician to change a light bulb whilst they're in your neighbour's house. Every time we sign something, we're putting our name against it, which means that it falls to us if something goes wrong. Hopefully it doesn't, but it means that there's an implication for everything we do. Every test we order has to be weighed carefully. Every time we do something, it has to be backed up by evidence. Every script needs to be specific to you and your needs. Of course, I am speaking idealistically. There are some doctors who don't follow this type of thing, and I'm sorry if you've ever come across them. It's not what I'd hope to see in GP as a whole. So all of that to say, a GP's wage can vary a lot. There is no average out there. Some do mainly mental health and bill a lot of that. Some do cosmetics, and there's a whole other scheme behind that. So it's really hard to tell you how much a GP makes. But at least you understand now how we can make money. If you did want to average it, I've got the numbers. So say a doctor works 35 hours a week, 4 patients an hour, gets 50% of their income and works 48 weeks. If they're brutal and don't bulk bill at all, they can earn up to $200,000 a year. Pretty good. That's the same as maybe a subspecialist in a hospital. I've written down here anyway. I can't remember which subspecialty I was looking at. I think it was cardiology. I haven't touched on private specialists like private cardiologists or private surgeons because that's not my place, right? I don't know any of that. It's probably similar but different. I hope that this has been interesting to you. And again, I'm not trying to like flex on you. I'm not trying to rub in how much I make. I'm just trying to explain how we make money. Trying to do this in a nice way has been really, really hard because I know I can come across as very defensive or very attackive. Because I know I can come across as very defensive sometimes or like I'm trying to attack. It's not what I'm trying to do at all. Basically, the long and short, in the hospitals you get a salary. Outside the hospitals, it's basically fee for service. Very short video there if that's all I explained. But I hope you found it interesting and informative. If you have any questions, let me know. Until next time guys though, stay safe, stay healthy, have a great 2021, and I'll see you in a video very soon.